Whether you lived with insulin-dependent diabetes for years or this is all new to you, you probably know how challenging it is to keep your blood sugars in range, especially after meals. I'm Christelle from Diabetes Strong, and I've been living with type 1 diabetes since 1997. So that means I've been dealing with this challenge for over 25 years. I don't always get it right, but over the years I have learned a few tricks, and today I'm sharing those with you. Because even though a lot of factors can impact blood sugars, I don't believe that I have to be at my blood sugar's mercy. So let me show you a few of the strategies that I use to help keep my blood sugars in range even after meals. This video is sponsored by MannKind, the makers of AFREZZA Inhalation Powder. My thoughts and my opinions are my own. Individual results may vary. Please see full prescribing information, including boxed warning, medication guide, and instruction for use at AFREZZA.com/safety. The American Diabetes Association's general recommendation is that your blood sugars before a meal should be 80 to 130 milligrams per deciliter, and that it 1 to 2 hours after the meal is back below 180 milligrams per deciliter. So how do you achieve that? Well, here are my top 3 tips. If you use injectable mealtime insulin, the key is to understand how it works. So when we talk about injectable insulin, we talk about onset, we talk about peak, and we talk about duration, or said in plain English, how fast does it start to work in the body? When is it the most effective in the body? And how long does it stay in the body? Take, for example, some of the most used injectable mealtime insulins. You might think that they start lowering your blood sugars as soon as they're injected, but that's actually not the case. Depending on the insulin, they might not start to work in the body until 15 minutes after injected. And they won't be their most effective, so they won't peak until 60 to 90 minutes after injected, and they'll stay in the body for 3 to 5 hours. I usually think about it as waves. So you have a wave from the food, you have a wave from the insulin, and you have to try and match the peaks of those 2 waves. Because of that, it's generally recommended that you inject your mealtime insulin 15 minutes before your meal, which is called pre-bolusing, and that is my first tip for keeping blood sugars in range after meals. Pre-bolusing doesn't always work for me though. It requires quite a bit of planning, and it also requires that I know how much I'm going to eat before I even have the food in front of me. So for some situations, I prefer to use an ultra-rapid inhaled insulin rather than my injectable insulin, and that is called AFREZZA. AFREZZA is an orally inhaled insulin that is used to control high blood sugars in adults with diabetes mellitus. Please stay tuned for important safety information about AFREZZA, included box warning at the end of this video. This testimonial represents my personal experience using AFREZZA and may not represent typical results. Results may vary. Please talk to your doctor to learn more about AFREZZA and if it may be an option for you. Okay, now that we have the safety note out of the way, let me show you how it actually helps me. Once inhaled, AFREZZA gets into the bloodstream in less than a minute, and it starts lowering blood sugar levels in as little as 12 minutes. Because it's that fast, it means that you can inhale your AFREZZA at the beginning of your meal. That means no need for pre-bolusing. Basically what that means is I can wait until I have my food in front of me until I've assessed how much insulin I need to then inhale my AFREZZA dose. And that was my second tip for keeping blood sugars in range after meals. Another thing I think about when trying to limit blood sugar fluctuations after meals is whether or not I'm eating something that's going to hit my blood sugars really fast or not. For example, if I'm eating a high glycemic food, I know that's going to hit my bloodstream really fast, and I have to take that into consideration when I time my insulin. Whereas low glycemic or medium glycemic foods are more likely to cause a gradual increase in blood sugars rather than a blood sugar spike. And those were the 3 things that I do to reduce my mealtime blood sugar spikes. I don't think you can completely eliminate fluctuations or occasional blood sugar spikes, but I have found that understanding the insulin that I take, using the appropriate insulin for different situations, and understanding how different types of foods hit my bloodstream has really made a huge difference. Thank you for watching. If you like this video, please give it a like below and leave me a comment. If you'd like to see more content from me, remember to subscribe to my channel and turn on notifications. That is that little bell. That way you'll be informed whenever I post new content. Keep watching for important safety information, and I'll see you next time. AFREZZA is a rapid-acting inhaled insulin used to control high blood sugar in adults with diabetes mellitus. AFREZZA may cause serious side effects, including sudden lung problems, low potassium, and heart failure. AFREZZA is not for patients with chronic lung disease, such as asthma or COPD. Tell your doctor if you smoke, recently stopped smoking, have ever had kidney or liver problems, a history of lung cancer, or if you're pregnant or breastfeeding. Most common side effects are low blood sugar, cough, and sore throat. Severe low blood sugar can be fatal. Do not replace basal insulin with AFREZZA. AFREZZA is not for use to treat diabetic ketoacidosis. Do not take AFREZZA if you're allergic to insulin. Talk to your doctor before changing your AFREZZA dose. Blood sugar may need to be checked more frequently.
Please see full prescribing information, including box warning, medication guide, and instructions for use at afrezza.com/safety.